Time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, is it the flu season? Do we have to be concerned about it? Well, we're going to learn a lot more about the flu season. I know, folks, we don't want to hear those things, but we got to be prepared. And today we have an expert on the show. At least I think she's an expert. Her name is Heather Sugarman, and she is a nurse practitioner with the Alliance Medical Group. As I said to you folks many times, we have a great healthcare system here in the greater Hazleton area. And when we bring our doctors on, our nurses on, and people like Heather, you will find out that they give you a lot of good information. Heather, how are you?
Good. How are you, Sam?
Randy's behaving?
Yes.
Family's okay?
Yes, everybody's okay.
Just want to check those things out first before we start. Nurse practitioner. You know, my wife is a registered nurse, so she definitely knows what a nurse practitioner is. But what is a nurse practitioner?
Well, a nurse practitioner is an advanced practice registered nurse. We do additional schooling past our master's degree, and we actually take an exam, a certification exam, that we are allowed to diagnose and treat and write prescriptions and take care of patients.
So how close are you to the doctor then?
Well, there are certain things we cannot do. We have limits on prescription medications. You know, can't sign for diabetic shoes. There's some things we can't do, but we can do almost close to what they can do.
Well, you're going to be more in demand if Obamacare continues on the way it is. It seems that they'll be going to more nurse practitioners and assistants.
Definitely. There is a bill in the Senate right now, Senate Bill 1063, that is for that we can not have our collaboration, that we don't need signatures by physicians for that because of the shortage.
And we're only hoping they're as qualified as you are.
I hope so.
Okay, so what is influenza?
Well, influenza, or the flu, is a contagious respiratory illness that is caused from influenza. And it is, there's two types of influenza, type A and type B.
Which one don't I want? I don't want either one of them.
You definitely don't want either.
Okay. What's A?
Well, it's not necessary. They're both viruses, and they're not specific. Both of them cause problems. You get them. You could get either from droplet contact with someone. So if someone with the flu sneezes, coughs, or talks, and the other person gets that droplet on them in their mouth or in their nose, they can get the influenza virus. Or if they cough or sneeze on a table or a chair and you touch that and you touch your mouth or you touch your nose, you could get the influenza virus. So they're viruses.
Okay, now, the signs and symptoms of influenza.
It could be fever, chills, runny, stuffy nose, cough, sore throat, fatigue, muscle aches. The difference between, though, the flu and a regular cold is that the flu, the symptoms are much, much more severe, much more severe.
What are they?
Well, the fatigue and all the ones that I just described, all those symptoms.
So there's where they're always a concern. Some people may feel they have a cold. Okay, I just got a cold, and they really have the flu. Okay, so what do you suggest?
Well, if you have extreme fatigue and muscle aches and a very high fever, you should see your provider. Or if you have these so-called what you think might be a cold symptoms for longer than a week, you definitely need to seek medical attention. Because also, if you do have influenza, those symptoms can become, you could have complications, bacterial pneumonia, ear infections, sinus infections. They could also exacerbate chronic medical problems like asthma and diabetes, heart disease. They can make all those much, much worse.
So the diagnosis is what?
The diagnosis, how you can diagnose the flu, we mainly do symptoms right now. The CDC, Center for Disease Control, does not recommend that we test everybody for the flu. They do test by doing a nasal swab, and they swab the inside of your nose, and then they test it to see if it's positive for influenza A or B. You should do that test if your treatment is going to change on somebody. If it's not going to change your treatment, then you don't necessarily need to do it. You can go by just symptoms. So if they have severe symptoms that are like the cold but very severe, then you can, you don't have to, you can treat them.
Okay, now, are there certain times of the year where the flu just starts peaking?
Definitely. Peak flu season is January, but flu can start as early as October and go all the way until May. So you definitely, and we're going to talk a little bit more on the flu vaccine.
Yeah.
That's why we say to get vaccinated as soon as the flu vaccine comes out. I've seen a lot of places get it as early as August.
Yeah.
They say mainly, ideally, get it by October, but you can get it as late as March. It takes 2 weeks for your body to build antibodies against the flu from the vaccine. So that's why you should get it mainly in, and I always say end of September, beginning of October. You definitely should have it by then.
No, I don't get the flu shot. Okay.
And why is that?
Well,
so?
I'm going to talk about that when we talk about the flu vaccine. Okay, because really I'm afraid because I'm a big baby, and some other concerns that people if they get the flu shot, they're going to get the flu. Okay, we'll talk about that as well. But let's talk about what options for flu vaccines are available.
Well, I was amazed at how many different options there are. The most common vaccine that they have out there is the trivalent flu vaccine, which is trivalent means there's 3 flus in that vaccine. There's 2 A's and 1 B. A group of researchers get together before every flu season, and they see by patterns what flus are going to be the most susceptible during that season, and then that's the ones they give. So there's 2 A's and 1 B in the trivalent flu vaccine. So there's the standard, which is for 6 months and older. There is a high dose potency trivalent, which is for age 65 and older. There is now an egg-free flu vaccine trivalent. There's also what's called an intradermal. Now those other ones I talked about you get in the muscle, intramuscular they call it. They do have an intradermal, which goes under the skin, trivalent. There's a quadrivalent vaccine, which means there's 4 types of flus in that vaccine, and that is 2 A's and 2 B's. Now, if you are afraid of the flu vaccine, you potentially can get the flu nasal mist. Now, the nasal mist flu vaccine, all those other vaccines I talked about are dead vaccines. The shots are dead vaccines. Dead viruses.
What do you mean?
They're dead flu viruses, so they're not live.
Okay.
So
what good are they?
Well,
they're dead.
Your body builds antibodies against them anyway, so they are good.
Okay.
The
Don't kid me now.
The
You may be convincing me to get my flu shot.
I'm definitely going to by the end of this.
Yeah.
The nasal flu vaccine is a live virus, but it's weakened. So you cannot get the flu. That's why you can't get the flu from the flu shot, flu vaccine, because it's a dead vaccine. Now, the nasal mist has a weakened flu vaccine, but the only people that can get it are age 2 to 49, and you have to be healthy. So, and that's because it is a weakened live vaccine. So if you are not healthy, you could potentially get the flu.
And we're gonna talk about staying healthy, okay? And there are people like, for example, thank the good Lord, I haven't had the flu shots, and every year so far I have been able to not get the flu. Probably this year you're going to jinx me, and we're going to have some serious conversations after I take this break. Folks, I'm talking to Heather Sugarman. You can reach her at 570-501-4AMG, and the AMG is the Alliance Medical Group, or go to myamghealth.org and get information about the flu. We're going to come back. Seriously, I'm going to talk to you about why I don't go and get the flu shot. Something tells me I'm going to get it. Stay with you. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, you can watch any of our programs on SSP TV at ssptv.com. My email is sam@ssptv.com, and these health shows are very informative and valuable. So today I'm speaking to Heather Sugarman, who is a nurse practitioner, and we're talking about influenza, which is the flu. Now, staying healthy. We always talk about preventative, things that could happen. So let's just, what should we be doing to stay healthy during the flu season?
Well, you should try to stay away from anybody that is sick. If you do get sick, you should stay home. And I know a lot of us do try to go to work when we are sick, but then you just end up getting everybody sick. You should take a multivitamin. When I start getting the sniffles or something, I take an over-the-counter Airborne, which is an over-the-counter vitamin that helps.
Shouldn't you be taking a vitamin every day?
Yeah,
like I do.
Yes, I do too.
Yeah. So if you're staying healthy, all right? That's one of the things that, you know, like I try to do is stay as healthy as I can, but sometimes your system weakens. And what makes your system weaken?
Well, there are people that are at increased risk, and we say anybody should get the flu vaccine who is at increased risk.
And what's increased risk?
Well, they call anybody over the age of 65 increased risk. Children younger than 5, especially younger than 2, increased risk. Pregnant women should get the flu vaccine. Anybody who works with anybody who could get any kind of complications from the flu. So any healthcare personnel should definitely get the flu vaccine. And then anybody with any chronic medical conditions, such as asthma, diabetes, heart disease. They actually say also the morbidly obese should get the flu vaccine because they're all at an increased risk.
So, all right, so the reason, I guess, probably is I'm from the old school sometimes thinking that if you get that flu shot, you're going to get sick. Some people get reactions to that, correct?
Yes, you can get mild runny nose, sore arm, sore throat, cough with the flu shot. Sometimes with the nasal mist you can get a little bit more since it is a live vaccine, but you cannot get the flu from these vaccines.
So you highly recommend that I should get the flu shot?
I definitely recommend that you should get the vaccine.
And why is that? Even though I'm healthy, thank God. If you jinx me and I get the flu this year, I'm coming after you, Heather, okay? No, so who should get vaccinated again?
Anybody over the age of 6 months, the CDC recommends now getting the flu vaccine.
Now, are these vaccines safe?
Yes, they are definitely researched, so they definitely are safe. Now, of course, there are rare risks. There are serious adverse reactions. There are what's called Guillain-Barré syndrome, and that's where you know, a paralyzing you know, illness. But those are very, very rare.
Well, how would you know if you're not subjected to some of those things?
Well, I mean, you may not know. You may not know. So you may just have to get the vaccine and see. They are very, very rare. Now, you should definitely not get vaccinated if you've ever had any kind of serious reaction to the flu vaccine before. If you have a moderate to severe allergy to eggs, now you can get that egg-free vaccine. You should not get it if you've had a history of Guillain-Barré syndrome, or of course anybody younger than the age of 6 months should not get the vaccine because it hasn't been tested on younger than 6 months. See,
you just brought something up about allergies, okay? Sometimes you may not know you have an allergy to something.
And there is no way to know if you would have an allergy to the flu vaccine.
So if you have, you know, an egg allergy, some people can eat a regular egg and nothing would happen. But if they eat a hard-boiled egg, something could happen. Okay, it's amazing that chemistry does something with the eggs.
Yeah, they do say, yes, there are people that could eat certain types of eggs, but they can't eat others. They say if you have a mild allergy to eggs, like if you get a little bit of hives, they can give you the flu vaccine with precautions. So sometimes they use Benadryl or a little bit of steroid prior to getting the vaccine, and then you won't get it. But if you have a moderate to severe allergy to eggs, then you are not to get the vaccine. Unless in your area they offer that egg-free vaccine, because not all areas of the vaccines I mentioned.
Fat-free vaccines?
Yeah, that would be great. That would be great.
You got egg-free, so you got fat-free, you know.
Not all vaccines are offered in all areas, so you do have to ask.
So do they have the egg-free vaccine in this area?
I don't know if they have it here. That's something I definitely have to find out.
Well, you find that out for us because we want to find out if Leanne, well, she'll get me the information. So if a person, what if a person has heart disease?
Well, a person with heart disease, and heart disease encompasses a couple different things: congestive heart failure, atrial fibrillation, cardiac arrhythmias, pulmonary heart disease, coronary artery disease. Those people that have those should definitely get the flu vaccine. And there's a couple reasons. Heart disease
should get the flu,
flu vaccine. Right. Heart disease itself puts you at an increased risk of any complications from the flu because your system is weakened when you have heart disease. Also, there's something called the vulnerable plaque theory, and that's where
you're killing me.
I know the flu can cause an increased risk of heart attacks because of this.
The flu can.
The flu itself.
Okay.
can cause increased risk of heart attacks. And that's because of this vulnerable plaque theory. And that's where plaque is in your body. Plaque is caused from cholesterol, high cholesterol, and the fat is on the side of your vessels. And the inflammation from the flu causes that plaque to become unstable, and it could break off and cause a heart attack or a stroke. So those people with heart disease should definitely get the flu vaccine.
So let's go back to basics here, okay? If a person has a proper diet, okay, and they're having the proper rest, because people, I think a lot of people are they need more rest, okay? Definitely. They're not sleeping enough, all right, because they think they're missing something. So if you have a proper diet, you're taking your vitamins, you're drinking you're staying refreshed with water, you pretty have and staying away from people who are that you think are sick, okay, you should have a pretty good chance of not getting the flu.
Well, the CDC does recommend anybody over 6 months of age get the flu vaccine.
You keep saying that. I understand that. Yeah. But what I'm trying to say is there's some people out.
You're trying to convince yourself not to get it.
You see, I knew you were smart for some reason. No, I probably will get the flu shot. Okay, I haven't received it. Dr. Benyukez keeps telling me you get the flu shot. No, I say, well, but I'm chancing it. Okay, really, I should get the flu shot, and that's it. And if I get the flu, I'm coming after you, and I'm coming after Leanne if I get the flu. But you don't get the flu, right? You just get symptoms. You said if you get some kind of reaction.
Yeah, from the flu vaccine. Yes.
What's the worst case scenario if you get the flu shot?
Well, I mean, the worst case scenario, which is very, very rare, is a serious allergic reaction, but that is very, very rare. Okay. Most of the time, people don't have any symptoms whatsoever, and what I tell them is I get the flu shot. I've gotten the flu shot every year since I was young, and I still get the flu shot every year, and that's what I try to tell people.
Mm-hmm. Now, what are percentages out there? Okay, do they have percentages of people who did not get the flu shot, got the flu, and people who did get the flu shot?
Well, they say over the last 30 years, and this is people dying from the flu. For the last 30 years, there has been anywhere 3,000 people, that's the least amount per year people die from the flu. Up until 49,000 people have died from the flu, and this is over the last 30 years. Mm-hmm. So it definitely is a large percentage, even 3,000 is a large percentage to pass away from the flu.
All right, so if someone wants to get the flu shot, all right, like me, okay, what do I do?
You can call one of our offices. Alliance Medical Group offers the flu vaccine at
Do I call now, or could I just put the request in?
You can definitely.
So in other words, if I call 570-5014-AMG, that's Alliance Medical Group, and get information, you'll set me up for getting the...
Definitely. Or you could go online at myamghealth.org and you can make an appointment. No, you have to make the appointment.
So you make the appointment.
Yeah.
Okay.
Now, if you don't have insurance, the flu vaccine is $25. At any of the offices, the flu vaccine is $25. Okay. So it definitely is worth paying.
But mostly Medicare and insurance...
Most insurances do cover it.
That. Okay. And so they can get the shot there, or at their physicians, if they're
definitely their primary care providers can give them the flu vaccine.
I would think, Heather, that probably a smart thing would do here, if I don't break my microphone. I would think maybe the smart thing to do is you should go for a physical exam anyway. Around if you haven't been, so the doctor could really do give you an exam and let you know how you're doing in general, and then give you the flu shot. Okay?
Well, everybody should get a well visit, what we call a well visit once a year. And if you have any chronic medical conditions, you should have more often. Some people come every 3 months. Some people come every 6 months. Mm-hmm. But if your yearly visit isn't around flu time, you can just come in for a quick injection. It's nurse given, or a medical assistant gives it, so you can just come in for a quick visit.
Okay, folks, I'm talking to Heather Sugarman, who is a nurse practitioner, about the flu season. When we come back, we'll talk a little bit more about the flu season. She may have me about 92% convinced to get the flu shot. Stay with us. Thanks for staying with us, folks. We're talking about the flu season with Heather Sugarman, who is a nurse practitioner with the Alliance Medical Group. And folks, you get information if you want to get the flu shot, 570-5014 AMG, which is the Alliance Medical Group. Now, we were talking during the break. Our friend here, Leanne, said that healthy people should get the flu shot. And why is that?
Well, what we're trying to do is everyone would get the flu vaccine. We are decreasing the amount of flu we're seeing in the area. Because of the severe complications that you can get from the flu itself, it's better if we can have as many people as we can be vaccinated so there isn't an epidemic of the flu.
Can I be a carrier even though I don't have the flu?
Well, it is potential that you don't get the extreme symptoms,
but
you then can give it to someone else that has maybe heart disease or something else, and then they get it worse.
So the long and short of it is we should all get the flu shots.
Definitely.
That's what you're trying to tell us, right? Okay. All right. So you convinced me we should get the flu shots. Now, again, going back to what I was telling you about the egg situation. If some people don't know whether they're allergic, okay, they should tell the physician or tell you and let you know that there may be a possibility here, and so you'll have to advise them accordingly.
Definitely. We'll definitely ask them how severe their reaction is to eggs, and then we definitely have to check and see if they do offer the egg-free vaccine in our area.
You should check that out. Okay.
For you, Sam.
Yeah, for me. Will you please? That's important. Well, you know, everybody knows I'm a big baby. Okay, it took me 2 years ago and see Dr. Muller to get a colonoscopy, but it's a piece of cake. I mean, really, I'm nuts because really there's nothing to it, and you really should do it. I mean, that's it. But thank God, you know, I have a wife that keeps on saying you should be doing this, and I go and get these checkups. Seniors sometimes have, you know, are always concerned, you know, and a lot of people stay inside. So some people feel, look, I don't go out in the wintertime. I'm here, you know, just my family, okay, so I don't need this flu shot. True or false?
Well, that's false because family comes into the house. And
unless you're a hermit.
Definitely,
okay.
definitely.
But you still have contact with people.
Yes.
Okay, now, speaking of that, there are some people, especially sometimes parents, they want to see their kids going to school. And, you know, they may not be feeling good, and then, you know, or you know, high school kids who just want to go to school. What do you tell parents or people who have symptoms that you should not be doing these things?
Well, if you are sick, and if your child's sick, you need to try to keep them at home. If you are sick, you need to stay at home, and then you need to see your provider if your symptoms do not improve.
Okay, so let's assume I'm a bad boy and I don't get the flu shot. However, the flu gets me, and I have the flu. And I call you up and say, Heather, it's Sammy, I got the flu. I don't want you hanging up on me, okay? What is the treatment for the flu?
Well, they can give you, the flu, again, is a virus, so we cannot give you an antibiotic to make the flu go away. There are antiviral medications like Tamiflu that they can use. Usually they're best given, and they work the best if they're given in the first 48 hours, but we can use them longer because flu symptoms can last up to 2 weeks sometimes. And then if you have those symptoms, and if you have them up to 2 weeks, you're at increased chance of getting bacterial complications. So you can also treat the symptoms of the flu with over-the-counter cold medication, and you need to check with your provider if you're allowed to take those medications.
Okay, so anybody who has any kind of health condition or not really feeling up to it, they should definitely get the flu shot, as well as you're saying anyone who is over the age of 6 months should definitely get the flu shot. We've established that. Okay, now, what about the, you know, you hear about washing of the hands. You know, sometimes when you're sneezing, some people go like this.
Yes, instead of
in their hand. Okay, but they say this is just as bad as in your hand, or, you know, etc. So you don't know what to do. Your hands, cut them off. You know, I mean, so what's the rule of thumb here? What should we do to at least prevent from carrying it?
Well, you do need to wash your hands very frequently, and if you do cough or sneeze, you do need to cover your mouth, and if it is better in your, you know, in your elbow rather than in your hand.
Yeah.
And as soon as you do sneeze, you know, you do need to wash your hands, or using antibacterial, you know, lotion or
Mm-hmm.
soap, you know, is definitely good. And to carry those little antibacterial
They're
in
important.
hand.
So, I mean, you know, in our business, you know, you meet a person, how are you? Just like I met you outside. I didn't know where your hand was. You didn't know where my hand was, okay? And so, you know, you want to make sure you wash your hands. Or some people, you know, I know in church sometimes when you're, you know, Catholic church, you know.
I was just going to say, in church, they stop most. I know my church stops shaking hands over the winter.
Yeah. Kissing's okay, though.
Kissing is definitely not okay.
No. So I'm not going to shake your hand, but give me a kiss. No, really. So we try to prevent as much as we can. So washing our hands or taking the antibacterial serum that they put on your hands, you should use that. Most likely, it's best if you have a tissue or a Kleenex. It would be better to. Is it better?
Yes, definitely.
To sneeze in a tissue or you know, or your handkerchief. So preventative things are always important, but the most important part, what you're saying, Heather Sugarman, is that we should get the flu shot.
Yes, we should get the flu
All right,
shot.
now you heard what Heather said. Okay, you give her a call at 501-4AMG. That's the 570-501-4AMG. Folks, I probably will definitely get the flu shot. I haven't had it in a while, but I think Heather really convinced me of it, so you don't take any chances. Wash your hands. Go to our website if you want to know more information. And don't forget, all of our GHHA shows are on the website with all the doctors who have come on and speak about different things. You can learn a lot more. And folks, remember, the doctors, the nurses, the aides that are working in the hospital today and all our medical staff, they need all the help they can get. It's a tough road for them. They're trying to do their best. So when you see those aides out there in the hospital and people who are working there, thank them, because they really appreciate that. We'll see you next time.